The Michelle Meow Show is your A through Z covering the LGBT, LMNOP, and everyone in between. And I'll start by introducing our esteemed panelists. Roger Dowdy has been an activist and leader in the LGBTQ movement for more than 25 years, and he has led Horizons Foundation since 2002. Dr. Nass is program director for the Eisenhower Family Medicine Residency in Rancho Mirage, California, where he practices hospital medicine and primary care with a focus on HIV and LGBTQ health. He serves as president of GLAMA, Gay Lesbian Medical Association, Health Professionals Advancing LGBTQ Health Equality. And Dr. Sean Cahill is Director of Health Policy Research at the Fenway Institute. He also serves on the Massachusetts Special Legislative Commission on LGBT Aging and is Associate Editor at LGBT Health. He's the author of Coronavirus, COVID-19, and Considerations for People Living with HIV and LGBTQI plus people. The Fenway Institute had sent that out earlier this month. Kenneth Mayer is Medical Research Director and co-chair of the Fenway Institute. He's also a professor of medicine at Harvard Medical School, and his areas of research include international HIV/AIDS, gay and bisexual men's health, HIV/AIDS prevention, microbicides, PrEP vaccines, secondary prevention, HIV/AIDS treatment, and antibiotic use, and molecular epidemiology of antibiotic resistance. I'm so thrilled and so excited that we pretty much have some of the best here on our panel today. Welcome all. We'll start with Dr. Nass and then begin with the rest of our panelists. It's been almost a month since the nation has been alerted of the COVID-19 pandemic, and I mean not alerted in a formal way. There's new information daily about this virus and how it impacts the body. We know that the virus attacks the respiratory system, but what new information might you have about this virus and what it does to the body? Dr. Nass.
Yeah, that's a great question, Michelle. I think what we see on the news quite often is the sensationalized, rightfully so, accounts of folks who are intubated on ventilators in the hospital, because we see how rapidly folks can deteriorate when they get this virus and how it does attack the lungs as part of the respiratory system. But that's the thing about viruses, is they really don't discriminate on where they like to be in the body. They like to go everywhere. And that's how when we get the flu, which is a virus, we can just feel crummy all over. We're finding now, as more and more folks are coming in the hospitals or being tested, and we're really seeing the severity of the illness from mild to severe, where folks are being placed on life support, we're really being able to find out more about where in the body is being affected. And as unfortunately, more and more folks are passing on from the virus, we're being able to do autopsies and see where else in the body is being affected. When folks are presenting with symptoms now, we're no longer focused on just the shortness of breath and the signs of possible pneumonia, which is what we were still focused on early. We're thinking more broadly because we're finding the virus in the GI tract, in the stomach, in the gut. We're finding it in the feces. And this is not too terribly different from where we see with influenza, the flu virus. We do often find that in feces as well. But what we're learning is, this being a novel virus, what does that mean for how it's affecting individuals? And we're seeing often folks now in the emergency department who come in just with diarrhea and nausea and then wind up having a positive COVID-19 test. They don't have shortness of breath, but then they're very high risk for potentially developing these systems as the body responds. We're seeing folks who have pre-existing heart conditions, heart disease, coronary artery disease, have varying responses to the virus as well. A lot of times the virus is causing additional inflammation in the heart that's causing them to have problems concomitant with having the viral infection actively, or sort of a post-viral syndrome where they're having what we call a cardiomyopathy, or an inflammation or a problem with the heart. And then generally we're seeing the virus overwhelm the immune system in a lot of folks. And this is why we're seeing such a bad response from the lungs. Not everybody who gets pneumonia goes into respiratory failure and has to be placed on life support. That's pretty uncommon for just a regular pneumonia. But what this virus is doing, it's overwhelming the body's immune system. It's causing the immune system to overreact and create a storm effect, where it's just really attacking all parts of the body, and the lungs are really feeling that most significantly. So it's a virus, but it's really clearly beyond that, and we're just now starting to see how much of an impact that's having on the body at large. I think the secondary effect from this, even folks who aren't living with the virus right now, we're all living with the virus, and it's taking an emotional toll. So I would have to say that, secondary to the actual physical effects or the infectious effects of the virus, we're all sort of in this constant fear, this constant stress mode, and that's really going to have a negative impact on folks for the long term, I think.
Sean, would you like to add anything to that?
Well, I would just say, Michelle, thank you for having us on today. We put out an issue brief about particular considerations for people living with HIV and LGBTQIA plus people. And so I would just say that in addition to what Dr. Nass just said, we have no information that LGBT people or people living with HIV are at greater risk of getting the coronavirus or the disease that it causes, COVID-19. However, some people with HIV and some LGBT people could have a greater risk of complications if they do get COVID-19. And there's a couple of reasons for this. One, as a population, people living with HIV and LGBT people are more likely to have some risk behaviors that can put you at greater risk of complications if you develop COVID-19. And first and foremost, that includes smoking, vaping, other substance use. Since this is a respiratory disease, people who use tobacco or other substances could have greater complications if they develop the disease. We also know that as a population, LGBT people, in addition to having higher rates of HIV than the general population, we're also likely to have higher rates of other chronic health conditions like cardiovascular disease, cancer, diabetes, obesity. And so those can all correlate with greater rates of complications if you get COVID-19.
Ken?
Yeah, in addition to what Sean said about these biological cofactors, we also know that LGBT people often don't feel affirmed in the healthcare that they're receiving, may delay accessing care because of anticipated stigma. So I think that's also a complexity that can lead to worse outcomes for people who are sexual gender minority people who are affected by the virus. So there are a number of factors that make us concerned the LGBT community could be disproportionately affected by this severe viral infection.
And Roger, I mean, I think, some new information you might have, you're probably hearing from a lot of the nonprofit organizations that provide direct care and services to our LGBTQ population. We'd love to hear anything new that might be coming down the pipeline on your end.
Well, thank you, Michelle, for having all of us on and for the topic today. And we're hearing from dozens of organizations that we work with, some of which are on the very front lines in terms of the provision of healthcare, in terms of working with LGBTQ seniors, some of the other populations that the other three folks on the panel just mentioned, and other ones that are just simply trying to continue to do their work under extreme conditions, whether it's adjusting to providing services from a remote location, changing their entire service delivery plans, or simply trying to work with an out-of-the-office mode. And that's putting significant strains on both the people who work at the nonprofit organizations themselves, but also, of course, on the access that clients and patients can have. And one thing I would add to what Dr. Mayer said is that it is true, and we found through a needs assessment we did here in the Bay Area, that significant portions of the LGBTQ population do not have access to the healthcare services that they need. They may be physically there, but their experiences with the healthcare system are such that they do not have the trust, and they don't have access to LGBTQ specific healthcare, such as Fenway is able to provide, or such as some of the organizations here in the Bay Area can provide. And so those folks are left with a choice that's really not a choice for them. And so that puts them at greater risk of COVID and at greater risk, particularly of developing complications that they then cannot access or are unwilling to access because of their own experience until the very last minute when the situation has grown dire.
Let me stay with you, Roger. This is John Zipper at the Commonwealth Club. And when we talk about groups that, we're all kind of starting to learn more and more about this, both us non-scientists as well as the doctors and researchers and such. One recurring thing we are seeing lately in the news is how the various, even governors of powerful states basically are not getting respirators and ventilators and even masks and stuff like that unless they're in good with the current occupant of the White House, basically tell the president he looks prettier, you're not going to get the information you need. You're not going to get the critical stuff you need. Is there a concern? I'll just say I have a concern that LGBTQ audiences, communities, residents, everyone is not going to be getting the information or other advice from the government, from the federal government, that other communities might be getting. Are we being left out because this is not an LGBTQ-friendly administration?
Well, I certainly share your sentiments about the sources of information and the levels of trust that we can put in where information is coming from. I believe that the concern is, of course, much broader, and everybody probably listening to this is aware of this, and certainly the panelists are, about the untrustworthiness, or at least the semi-trustworthiness of information we've been getting from some of the sources that ought to be the most trustworthy. And that applies to LGBTQ people as much as it does to everybody else. To the extent that LGBTQ people may be more isolated, and particular populations of LGBTQ people. So, for example, LGBTQ seniors, more LGBTQ seniors live alone than in the general population. More of them are not partnered than in the general population. And those kinds of situations can lead someone to not only have the challenges of being isolated and some of the emotional and psychological burdens that can be, but it might also mean that they have less access to information, or they have no filters or other sources to be able to compare information with. So I think the problem really, John, is it cuts all across all populations, and we are certainly not immune from that.
Does anyone want to add to that? Sean?
Yeah, I'd like to just add a couple of things. So, we've heard a lot about how President Trump disbanded an emergent, a panel that would look at emergency pandemics like this when he first came into office, and a lot of other things that have been done that kind of weakened our country's readiness to respond to this pandemic. And I just want to mention two things that really disproportionately affect LGBT people and people living with HIV that this administration has been doing for the last 3 years. One is they have been removing explicit non-discrimination protections from health regulations that explicitly prohibited discrimination on the basis of sexual orientation and gender identity. These regulations govern the PACE program, the program of all-encompassing care for the elderly, which provides healthcare and elder services to nursing home eligible elders to allow them to remain in their homes and not have to go into an institution. These regulations governed the health insurance exchanges, healthcare in general, and both private insurance and public insurance. In addition, the administration has been promoting religious refusal policies, which basically allow healthcare providers and social service providers to refuse to care for LGBT people based on their religious or moral objection. And then finally, this administration has systematically tried to dismantle the Affordable Care Act. And that Affordable Care Act has helped the entire US population, but it has disproportionately helped our communities. It has cut the uninsurance rate in the LGBT community from about 22% to about 10%. It has helped more and more people living with HIV get insurance who prior to the ACA had a pre-existing condition and nobody would insure them. It's also helped a lot of people with HIV get Medicaid because of Medicaid expansion. So, all of those things helped our community disproportionately, the non-discrimination protections and the insurance coverage under the Affordable Care Act. And just a couple of days ago, at one of the White House task force briefings, a reporter asked President Trump if he would reopen the enrollment period for the Affordable Care Act, and he let Vice President Pence respond. Vice President Pence really didn't answer the reporter's question, and then President Trump made a joke about how Mike Pence had just done this very politically expedient but very cynical thing of not answering the reporter's questions about ACA enrollment. So.
Anyone else want to add?
Yeah, I would add, Sean pointed out some really negative messaging and actions coming out from the federal level. And I think one of the things we're not seeing is messaging that's inclusive of our communities, of the LGBTQI plus communities, coming from that level. And so it's really being left up to local organizations to step in and fill that void. And then GLAMA recently, in partnership with the National LGBT Cancer Center, Whitman Walker Health, SAGE, New York Transgender Advocacy Group, and the National Asian Pacific Islander Alliance, released an open letter on coronavirus and the LGBTQ plus communities, asking media and health officials to weigh the added risk of being LGBTQI, as many of the speakers have mentioned already today. Horizons Foundation and Fenway were additional signers of that letter as well. And really the point was to try to fill the gap where we aren't seeing this inclusive messaging and really get the message out there that folks are seen in their communities and their health matters no matter their identities. And so we're really proud that we had over 150 signatories now on that letter, organizations.
And if I may, while we're on this topic, I can't help, and I'm sure this will come up at other times in our conversation, I really can't help but comment on for those of us who've been around long enough to remember hostile federal governments when things were attacking our community, and in particular around HIV. There were plenty of other ways that we've been attacked, but we lived for years and years with a federal government that couldn't even say the name of this terrible rampaging epidemic. And so we are used to not having the information we need from the very top and being able to have to try to find information from our own community, from other sources that we trust. Like here in San Francisco, we're very fortunate that we have a Department of Public Health that has been very much on top of things and communicative and very LGBTQ affirming and inclusive. And ditto, and fortunately, in at least some parts of the country.
Thank you. We'll go to Dr. Mayer. Speaking of misinformation, not enough information, and non-inclusive messaging, I mean, there are lots of us talking privately or in chat rooms, and this has been thrown out there that HIV medicine can actually help with, if you're infected with COVID-19. And I know that the brief that was shared by the Fenway Institute focuses on a whole lot of what those living with HIV should really be doing to keep themselves safe. But let's start with that and addressing, that conversation. HIV medicine, does it help if you're infected with COVID-19?
It doesn't help and it doesn't hurt. There was a reasonable speculation why one of the types of HIV medicine could be helpful, because this virus, which is not related to HIV, has what's called a protease enzyme. It helps in its taking over of cells. And so in theory, drugs that inhibit proteases could inhibit this virus. So there's one called lopinavir, which in the test tube had some possibly encouraging data, but then there was a trial in China that suggested that it wasn't beneficial. And people have done more work very quickly to say that the protease, the enzyme in this virus, is sufficiently different than the one in HIV, that we shouldn't be thinking of these medicines as concomitant. I mean, there are a number of interesting medications that are being tried now. So there are a number of different trials, and that's the most encouraging thing. If we could find a medicine that was effective, it would help the people who are very sick, hopefully. And if it was safe and well tolerated enough, it might be able to be used as PEP or PrEP as well. So in the short run, that's probably going to be a quicker way of getting this epidemic under control, in addition to physical distancing and the other public health measures, would be the medical route. But even those trials are going to take some time. So we're certainly not going to be out of the woods for weeks and months to come.
Dr. Nass, would you like to add anything to that topic?
No, Dr. Mayer summarized it very well. I think folks right now are really looking for anything they can grab onto that's hopeful, and just the fact that there are trials ongoing and we're looking at novel ways that we can treat a very novel infection, and really looking for anything that we can, in the medical research communities.
Yeah, and unfortunately, the only other thing we're saying, again, with lots of concerns that we have about national leadership, the idea of sort of promoting any one thing as a quick fix is not helpful. And I think that really gives people the kind of false hope. And, what we need is to do these things in a rigorous way so that we know something works or that it doesn't work. And fortunately, those studies are underway. But I think when, it's sort of like watching an accident waiting to happen by watching these press conferences every day. But people need to take, particularly the scientific pronouncements from national leadership, with a grain of salt.
We'll go to Dr. Cahill, and to add to that, I know that the brief did talk about some specific things those living with HIV or chronic illnesses should be doing to keep them safe. Let's talk about that.
Sure. So, in a time when we don't have a pandemic like we do with COVID-19, it's very important for people living with HIV to take their medications and to take care of themselves. And most people living with HIV in the United States are doing that. They're treatment adherent. They've suppressed their virus, and they take care of their health in other ways. They eat healthy. They try to get a good night's sleep. They exercise. So we're strongly encouraging everyone to do that and to continue to do that. If they do that, and then they get they get the virus and they develop COVID-19, there's no evidence at this point that they will have a worse outcome than somebody who doesn't have HIV. However, if they have comorbidities, co-occurring conditions, which many people living with HIV in the US have, then that can, exacerbate their experience with COVID-19. Being older is also a risk factor, and about half of people with HIV in the US now are age 50 or older. So those are concerns. I've heard from some HIV activists in recent days who've just expressed some concerns. There's a lot of anxiety in the community, partly because, like Roger said, this brings back memories of, 30, 40 years ago when we had a government that was not taking an epidemic as seriously as it should, and where prejudice was animating our response to the epidemic. We've seen that with people calling this the Chinese virus and trying to blame a country, and I think putting Chinese Americans and Asian Pacific Islander Americans at risk by stigmatizing this. So that's not helpful. But a lot of people with HIV have those concerns. A lot of older LGBT people who were, whether they were directly or indirectly affected by the epidemic, the reaction to HIV in this country was a homophobic reaction. And so even lesbians who may have had relatively low risk of HIV infection were very much affected by the HIV epidemic in this country and played a big role in the community response to that epidemic in the absence of government action. But some of the concerns that I've been hearing from HIV activists include just being concerned about if they get COVID-19, how will this affect them? This is particularly a concern among long-term survivors who've been living with HIV since before the antiretrovirals came on the scene about 25 years ago. People are worried if they're going to be able to get their medications when they're hospitalized. One person told me that people with HIV are having trouble getting their lab work done, and they're being told only if it's an emergency can they get their blood work done. And there's also reports that that if you have HIV and you get COVID-19, that the inflammation can be worse, that some of the side effects of antiretroviral medications may be exacerbated. So those are some of the concerns people with HIV are expressing at the moment.
Dr. Nass, you mentioned this letter that had been put out by a number of organizations, and I believe that letter also noted the 50% higher percentage of LGBTQ folks who smoke, who use tobacco at least, other than the general population. I kind of want to get into that kind of a bit of the whys on that, but also, if you could, how does the LGBTQ community, compare in terms of other drugs? And I'm thinking of recreational drugs and such, and what are any specific dangers or things they should know now that could affect them in the case of coronavirus?
There is evidence out there that certain subpopulations within the LGBTQ plus communities do have higher rates of recreational drug use, gay men who have sex with men specifically, and we do a lot of risk reduction around sexual health in that area as well, encouraging folks to not use when they're engaging in sexual activities, or to use PrEP or other opportunities to protect themselves when they know they're going to be engaging in recreational drug use. There really, this being so novel a situation, there isn't a lot of research right now. I haven't heard anything actually about looking at the implications of using crystal methamphetamine, cocaine, marijuana, really any sort of drugs that people would take to extremes in that regard. But that's an interesting area where I think we do need to consider. Certainly some of those some medications, some of those drugs, crystal meth and cocaine in particular, do cause cardiac problems, so problems with the heart. So folks can have heart attacks or cardiomyopathy, like an enlargement of the heart. And so given that this inflammatory effect of the coronavirus that causes COVID-19 does affect the heart tissue in many cases, that would be something where I would expect there to be some additional risk. And so folks should just, take care. That's one of the challenges in general. I practice addiction medicine as well. And one of the challenges we're seeing is how the government has been fairly quick to loosen a lot of the requirements for face-to-face visits, where often we have to do things in the clinic face-to-face with patients who are long-term substance users, for example. And now, because of the telemedicine requirements have been loosened, we're able to do more of that over the phone. And so I think, and over video chat or what have you. So we're having to be more creative. I don't know that the messaging is really out there as widespread as it needs to be, though, in terms of harm reduction in these areas. So that's a good point, I think, somewhere that we can certainly take our advocacy efforts. Smoking, we do know that there's 50% greater use of tobacco within our communities, and a significantly higher rate of smoking as well. We do know that smoking weakens the ability of the lungs to fight infections. So therefore, the LGBTQ plus communities are naturally going to be more affected, if folks are smokers as well. So we're learning a lot about this as we go, but certainly whatever we can do to engage in self-care and prevention are going to be really important as we protect ourselves during this pandemic.
Yeah, I agree with Dr. Nass. Everything you mentioned is right on. I think with regard to some of the specific substances, there are reasons to think they might have create added problems. Certainly with crystal meth, the issue for a number of people that if they vape it, that's particularly bad, going directly to the lungs. And there's also data that says that people who use crystal meth and cocaine may have more of a chronic inflammatory condition. So the condition that Dr. Nass mentioned, the latter part of COVID-19 disease, where there's this inflammatory storm, this might be exacerbated if people are using these drugs. And then opioids, we have the sort of opposite concern, which is that one of the things they do is they suppress breathing function. And you really don't want to have somebody to be habituated where they're not taking deep breaths when they have this inflammatory pneumonia. So there are a lot of reasons why we have concerns about substances. But getting to the question about why do people use substances in a world of where people's lives are not affirmed, this is a form of self-medication for many individuals. So again, gets back to some of the social and structural issues that explain some of these increased rates of substance use in some of the LGBT subpopulations.
Speaking of self-care, sorry, Dr. Nass, did you want to add?
I was just going to say, back to the smoking. Smoking is a very social activity, and in the bar culture, especially for gay men and lesbian women, or gays and lesbians, I should say, that's a big part of where that started and has sort of perpetuated even into modern generations.
Which is a great segue anyway to the next question, and I was going to toss this to Roger, and having worked with so many community leaders and foundations and organizations, but I mentioned this to a friend who was checking up on me this morning, and I talked about how this part of self-care, that we need to isolate ourselves. We need to stay home. We need to not be around other people, how difficult actually this is for members of our community. And it does gravely impact our mental health. But our entire, liberation movement was built upon the freedom to socialize, to be with each other, to be out and to be open. And so if you could just spend a little bit of time to talk about, the coping mechanisms or ways of coping, or sharing just maybe what you're hearing out there from our community socially of how they're handling this, because I think that would be helpful for many of us who are absolutely impacted and scared and also depressed by having to be isolated.
I think you're absolutely right about that. And one of the things that I have done a lot of thinking about, and I suspect that others have as well, is that, and it goes back a little bit to something you said, Dr. Mayer, that this is weeks, months, hopefully not longer than that. And in some ways, while this has been a tremendously difficult adjustment for millions and millions of people, including millions of LGBTQ people, that in some ways it's going to get harder, especially from what you're talking about, Michelle, because the longer that these periods of shelter in place and social isolation go on, the more challenging it's going to be for folks who, whether they're queer or otherwise, especially who have mental health challenges or are isolated in different ways. And some of those data, as some of the other folks on this panel can probably quote more fully than I can, there are significant mental health challenges in a significant part of our community. There are, as I mentioned before, elders who are LGBTQ identified are more likely to live alone, more prone to potential isolation. And so how we respond, one thing that gives me a lot of hope is that we are also an incredibly creative and resourceful community, that we have proven that again and again and again, and not just around HIV, although that was a world historic kind of level of creativity and resilience in response. And so people are coming up with all kinds of different ways to be able to counter that social isolation. And a number of the organizations that Horizons has the privilege of supporting here are doing things to make sure that they are reaching their folks, their clients, in entirely different ways. So one senior serving organization, for example, called Open House here in San Francisco, that they have moved everything to online, to telephone, to groups, and they support hundreds of elder LGBTQ folks, and they've just retooled everything that they do. And I've seen that also in trans communities and trans organizations, healthcare providers, and many others.
Anyone else want to add?
I'll just add to what Roger said about social isolation. So we know that LGBT older adults are more likely to be socially isolated. We're less likely to have children and grandchildren, even though many of us do. But so we don't have that built-in caregiving system that most people rely upon. But we also see social isolation among sort of across the age spectrum in our community. And we know that a lot of LGBT youth are at home with their families. And if they have a supportive family, that can be a safe place, right? We tell everybody, stay home and stay safe. But if your family is hostile to you because of your sexual or gender identity, that may not be a safe space. It may be safe from the coronavirus, but it may not be safe in other ways. Similarly, we're concerned about intimate partner violence and domestic violence within our community, which is an issue at any time. But when you're confined to the home for weeks and months on end, it could be exacerbated. So I think that we have concerns about individuals who are living alone, who are single. We have concerns also about people who are in a partnered relationship as well.
Dr. Kale, sticking on part of that, in San Francisco, I know, and maybe it's true in other big cities, a larger part of our homeless population is LGBTQ, including youth. Who's addressing health services for them? What specific needs are those homeless youth going to have?
Yes, it's a very good question. I know that the homeless population in general, homeless youth across the age spectrum, is very vulnerable to this pandemic. And so we actually include in our brief some best practices for people serving homeless populations to try to minimize their risk. We have a program in Cambridge, Massachusetts, just across the river from Fenway Community Health Center, called Youth on Fire, and that population is working with homeless youth. And we have a number of other organizations in Boston, the Boston Alliance of GLBT Youth. And I know a lot of their work is shifting to virtual support, kind of like Roger just mentioned, for senior groups in San Francisco. So I think that, our community is innovative. A lot of us, particularly on the younger end of the age spectrum, are very attuned to technology. And I think we need to use this virtual technology to create virtual community for the foreseeable future to try to minimize people's risk. Just one other population that's related. We see the LGBT youth population overrepresented in the homeless population. They're also overrepresented in the juvenile justice involved population. And it's possible that among adults, LGBT people are overrepresented. Definitely transgender women are overrepresented in the incarcerated population. And we have a lot of concerns about that population as well. They're very vulnerable to the coronavirus and to developing COVID-19. And so I certainly support efforts to try to, release as many people as possible who are non-violent, non-dangerous offenders.
Dr. Mayer, there was an article that was shared, and it was a story of an individual who had found out that he had recovered from COVID-19 and wanted to donate his blood because of some news out there that antibodies can be effective in the fight against COVID-19. And so I'd love to hear your thoughts. First of all, what are antibodies and why are researchers looking into this as possible effective ways in fighting against COVID-19, and why wouldn't they take his blood? Oh, I forgot to add, they wouldn't take his blood because he was taking PrEP, and so if we could have a discussion around that, why taking blood, anyone on PrEP they wouldn't take it for the purpose of trying to get antibodies.
Yeah, thanks for the question, Michelle. So antibodies are an immune response to something that the body thinks is foreign. It's one of two kinds of major responses. The body can respond by having primed white blood cells like Pac-Man kinds of cells that will gobble up a virus or a bacteria when it gets in the bloodstream, for example, and might limit cancer cells. But antibodies are a very common response. They're basically proteins that look like a Y, and the two prongs of the Y kind of glom on and do various things that things that the body perceives are foreign. So it's hoped that antibodies will be sufficient to protect against COVID-19. The reason for that hope, because antibodies don't always protect against all infections. For example, people who become HIV infected develop antibodies, but the antibodies that they develop recognize the virus, but they're not effective in eliminating the virus. Whereas antibodies, certain kinds of antibodies, for example, for hepatitis B, antibodies to the surface of hepatitis B are protective. So an antibody doesn't equal protection, but there have been some experiments in animals that show that when the animals are exposed to the virus that causes COVID-19, when antibodies are made and then the animals are rechallenged, those animals are protected. So that's the basis for the hope of that protection, but we don't know for sure. The other thing is that there are two other viruses that are similar to COVID-19. One is the virus associated with SARS, which was a very bad respiratory infection, but didn't spread very far around a decade ago. And the other is Middle Eastern respiratory syndrome, MERS. And people who develop antibodies for both those infections seem to have a level of protection. So that's the hope. So this idea of taking somebody's blood and pulling out the antibodies and then infusing into somebody else this is something that was actually done even before we had antibiotics. So it goes back more than 100 years, this idea of hyperimmune plasma. So it's a reasonable approach. Getting to this individual, this actually ties together this whole issue about blood transfusion, blood donation, which happened this week. The Red Cross has been told for years that the screening tests, the concern was that somebody who was sexually active, a gay man who had condomless sex, who might not have had time to develop antibodies against HIV, that the screening might not pick up the fact that they had early HIV infection. But there are now tests that can pick up the genetic material, the RNA of HIV early on, and can be very precise. So you can screen blood and for other infections. So they've narrowed the window and say, well, it's not perfect, but we'll make it, instead of a year, we'll make the exclusion 3 months, which is progress. The issue about PrEP is the irony of PrEP is that if somebody takes PrEP and they become HIV infected, say that they're not completely adherent to the medication, so they're taking it for a while. They have an episode where they stop taking it and they get infected with HIV, but they start the medication again. It will partially suppress the virus, and a person might have a negative antibody test then, and you might not even detect HIV genetic material in the blood, the screening test. And that's the concern, is that if somebody's on PrEP, they might have a false negative signal where they are actually truly HIV infected or have another serious viral infection that they might not be picking up. But I think practically, if somebody is at the present time having condomless sex, we think it's more important for them to be using PrEP to protect themselves against becoming HIV infected, as wonderful it is as it is that they want to donate their plasma. Now, if they say, well, I'm not having condomless sex now for a period of time, then certainly considering stopping PrEP, if they really are clear that they're not going to be protected for that period of time. So that would be the way that they might navigate that. A lot to unpack there, but it was an important question.
Thank you. Anyone want to add to that?
Yeah, I would just say that as Dr. Romero was focusing on, the science is there in terms of looking at the risk that of having different individuals donate blood or plasma or whatever it might be. And the administration, for not just this administration, but past administrations, have been very hesitant to move towards a science-based decision-making process, looking at screening for risk factors. And we still are very focused on this identity, men who have sex with men, as opposed to the actual risk behaviors and the risk that translates into that antibody process that Dr. Mero was describing. So Glamour released a statement, as many other organizations have this week, lauding the FDA for their movement in the right direction, but certainly it's far from perfect, and we have some ways to go to have policy that lines up with the science that we know and trust.
We have a question from...
Can I just add to that? We also, Fenway Health agrees that it's a very important step in the right direction. It's not a perfect policy by any means, but it's important to point out that in 2015, we had a lifetime ban on MSM donating blood. And then it went to a 12-month ban, and now it's a 3-month ban. So in the last 5 years, we've had a significant improvement in the policy in regard to MSM, also in regard to commercial sex workers and people who inject drugs. They also are now at a 3-month deferral as opposed to a longer deferral. So this is a significant improvement, even though it's not a perfect policy.
We have a question from someone, our viewing audience. They ask, for your perspective on CD4 levels as indicator of health of immune systems in case of a COVID infection. Does anyone want to talk about that?
Well, CD4 cells for somebody who's HIV infected is certainly important marker of their immune status, and certainly somebody with a lower CD4 count need to be more concerned that they may have various kinds of complications. COVID-19 per se is a problem for people HIV infected, uninfected, high and low CD4. So I don't think we're focused so much on the CD4 right now in relation to COVID-19. But getting back to something Sean said earlier, if the CD4 count is low because the person's not on medication or not adherent to medication, that certainly is a concern, because we do think that the most important thing is to be suppressing the virus with the medication. I don't know if the viewer was asking about CD4 for everyone, which is not something that we would do as a test make any determination about risk or how somebody was going to do with COVID-19.
Yeah. Would you like to ask more questions from?
Sure, we have some other questions. One person asks, and this kind of builds on what we were talking about earlier, so I'll throw it to you, Dr. Nass. What is the danger for a clean and sober former heavy drug user? So they don't indicate what drugs they're talking about, but anything that would affect someone who not using stuff now, but has it in their past.
Yeah, I think that folks who have chronically used various substances for a long period of time can probably attest that they know their body has changed in certain ways that they can't quite undo. We talked about long-term cocaine or methamphetamine use can have effects on the heart, the blood vessels. Long-term smoking can have impacts on the lungs. Line. Alcohol long-term really has significant effects on the liver as well. And, all of these substances over time can remodel the brain. We say, rewire the way that it functions. And that's why folks have these long-term cravings often for various substances, not all substances, but many. I think there's not a lot of research there, but I would suppose that if folks do have a long-term use in their history, that certain organs may be more affected, like I just mentioned, and that may put them more at risk for effects of the coronavirus on those particular organs, especially the heart and the lungs that we've talked a lot about. But we're also seeing, folks with co-occurring liver conditions as well are a little quicker to go into liver failure or just because the liver isn't as healthy as it should be. So those are things to consider, and just additional reasons to practice physical distancing and really staying away from folks as much as possible so that you avoid contracting the virus.
Yeah. Do you want to? We have about 15 minutes.
Okay. Well, I've got another question, and this almost goes back to my first question. But someone in the audience asks, as COVID peaks over the next 3 weeks, are you worried about LGBTQ people being triaged away from critical resources such as beds, ventilators, masks, in particular in states, that have fewer LGBTQ protections? Anybody on that? Roger, any thoughts?
Well, I am unaware of any reports of that happening, but I'm also the one on the call who's really not directly in the health field.
Right.
In a world and in a country where discrimination is a reality, and where people a significant portion of the population continue to view us as less than in any given circumstance, particularly outside of some of the major urban centers, I think that could always be a concern, and that concern would also pertain, on the basis of people of color, and certainly on the basis of folks like transgender people in our community. But people act out of, irrespective of their training, they can be affected by biases that they may not even be conscious of. And so, yes, I would always be concerned about that. But again, I want to stress, I'm not aware that is actually taking place, at least to my awareness.
Jonathan, I'll just add to that. The members of the Congressional LGBTQ Caucus are worried about this, and that's why they've written a letter to the administration asking them to clarify, what their approach is going to be in terms of discrimination in healthcare. And asking them to ensure that LGBT people are not going to be treated differently. Because for the last 3+ years, this administration has, even just last week, I think the Department of Justice submitted a friend of the court brief in a case saying that sex stereotyping under Title IX and Title VII, Title IX of the Education Amendments and Title VII of the Civil Rights Act does not encompass gender identity discrimination and some forms of anti-gay, lesbian, bisexual discrimination. The federal courts have actually said that it does, that certain forms of anti-LGBT discrimination are sex stereotyping and are prohibited by Title IX and Title VII, but the administration is saying that they're not. And so members of Congress are very concerned that what you described or what the questioner described could be playing out in the field.
We'll spend the last 13 minutes or so. I know that a couple questions are trickling in, so we'll do our best to get your questions answered if you're sending them in. But to all of our panelists, we'll start with Roger. I mean, the LGBTQ community has definitely weathered through some tough times. And our resiliency is in, coming together to help all in our community. And so if we could spend some time, each of you giving some thought on how we might get through this with some of the issues that we talked about. And I'll give some examples. I mean, some folks are coming together to sew face masks. Some people are cooking meals, for those on the front lines, like our nurses and those who are working in grocery stores. So Roger, why don't we start with, we know that there are segments of our communities and nonprofit organizations that give care to our communities who will be devastated by this. What kinds of things is the foundation doing to make sure that some of our organizations stay healthy? And then just some thoughts on how we come together.
Well, thank you for that, Michelle. And I will say, and I'm sure that the same is true in Boston and in the desert area where Dr. Nass is, that organizations are terrified. I mean, they are doing two things at once. They are, on the one hand, they are springing into action, and sometimes, as I described before, the couple examples, in deeply inspiring, creative, all-out kind of ways. People just working around the clock to make things happen for the constituencies they serve. And there is a great deal of fear, particularly about revenue. And organizations that are dependent on different sources of revenue, especially those that depend on individual donors and also foundations, are very, very concerned about, in some cases, their very near-term future. And in every case, their middle and longer-term future. That ranges from the cancellation of major fundraising events to groups that hold conferences or do other vital activities that they get registration fees from. And we have organization after organization after organization that is suddenly hemorrhaging money. There are some opportunities, and with respect to individuals, it goes without saying that as people watch their portfolios, or if they are lucky enough to have a 401k and all that go down, we're worried about giving. And the truth is that most support for LGBTQ groups comes from LGBTQ individuals. And we're just a minority of the population. And of course, we're all responding to more general calls for help as well. We need also to focus on what's in our community, because while we have wonderful allies, mostly it's going to come from us. And with respect to foundations, LGBTQ causes get only 28 cents for every $100 that foundations grant out in the United States. And that small amount of money to begin with, the other fact is that many foundations, in a time of economic crisis, they're going to focus in more closely on what they view as their most core activities and the most core organizations. And very few foundations make our community one of their key focuses. And so therefore, a lot of that grant support is potentially vulnerable because we're just not top of the list of the great majority of foundations. And that is where a place like Horizons Foundation can come in as an LGBTQ specific foundation. So we've launched an emergency grants program that we've dedicated funds coming off of our own endowment to go to. We're raising money from individual donors. We're well over $100,000 just from donors and counting, as well as a few $100,000 of our own money, all going directly to organizations that are impacted by this crisis. And I'll just talk for one moment on your last part of your question, how are we going to get through this? It's all the ways that you mentioned, Michelle. It's by people finding what they can do. And we as a community know how to do this, not against COVID because it's brand new, but we know how to do this. We're activists, we're innovators, we're the kind of people who see a problem and a challenge for our community, and we can come together and we can find ways to do it together, individually. And part of that has to be also by those who are able. Many people, of course, are losing their jobs and don't have money to give, but those who are able, please give. You can give to Horizons COVID Emergency Fund. There are many other worthy places that you can give, but this is the time to do it. This is the rainy day. and people need your help now.
Anyone want to add to that?
Michelle, I'll just add that our community is very economically vulnerable. Prior to the pandemic, based on data that the Williams Institute has put out, we know that LGBT people are more likely to be poor, especially sexual minority women and transgender people in our community, and especially people of color in our community are more likely to be low income. So I think that, we know that at least 10 million people have applied for unemployment in the last 2 weeks. Many more have tried to apply and just can't get through to anyone. We know that, our community anecdotally is disproportionately represented in food services, in restaurant work, in the entertainment industry, which have all basically shut down. So I think that as a community, we have to do like Roger said, we have to give, we have to support those of us who are lucky enough to have an income, to have jobs, to have a roof over our head, and really prioritize the most vulnerable in our communities. And that includes homeless people, it includes those who are incarcerated, because even if we can get them out of prison or jail, where do they go? People are having trouble paying their rent, their mortgages, immigrants, particularly undocumented immigrants, is any of this relief funding available to them? Probably not, So I think we really have to prioritize the most vulnerable and help, as a community, help people to get through this.
We have about 7 minutes, and then I'll come back to Dr. Nass, Dr. Mayer, for some last thoughts. But was there a question, John, that you might want to ask the panelists from our audience?
Well, someone watching on online did ask, and it's almost, I think it fits in nicely to what we were just talking about, which is creative ways that people are, that individuals are doing something. And specifically they asked, are there any gay volunteer organizations to reach out to elderly LGBTQI during these times? Someone else wrote in suggesting video conferencing happy hour, or a meetup or something like that. Does anyone know of any of those things? And more important, because it kind of gets to, yes, an individual can do some things. If they want to write a check, they now know some places to write the check to. But if they wanted to do some of these other creative things, are there any groups that they can go to and who maybe have the advice or the infrastructure or the connections to put them in touch with someone who would want to do one of these creative things?
Yeah, I think that's a great way to respond to what's going on around us. Not everyone does have the financial means to be able to donate, but those who can, please do. I would echo what everyone else has already said. But the energy we have, especially it's so pent up because we're staying home together, as various hashtags are on social media. We are all in this together. Those of us who live in areas like the Bay Area or the desert where I am, that are very fortunate to have very robust, lively LGBTQ+ communities. There's no dearth of organizations who are out there still trying to do their work and fulfill their missions, despite not being able to have folks come to them. So if you live in a community like that, just search online, go to the yellow pages, wherever you can look to find who is in your community and reach out to them directly. Give a phone call, send an email, because I'm sure they have some way that they could put your time and energy to use. Especially, we talked before about elders being very much less likely to access services that are available, LGBTQ elders. So something like meal delivery, as was mentioned, would be so important for folks who don't have the mobility to get out and to get to the grocery from 7 to 9 in the morning, when a grocery might be having a special senior time. They just might not be able to do that. So how can we help them have that same access? And it would go for anyone who lacks the ability for whatever reason to access those services. For folks not in communities where there are robust organizations helping in that way, I don't know if there's anything going on at the national level. I haven't seen that. But that's there must be somebody in the community who's focusing on just elders generally, or youth, or the homeless, and you could empower yourself to give your drive to help the LGBTQ communities within that sector. Give them that energy. I think that would be. There
are a couple of potential national resources that folks, depending on where you're listening. I mean, I know Bay Area organizations, but there's SAGE. Which is based in New York, but it has affiliates around the country, and also is aware of a lot of elder LGBTQ organizations. There's CenterLink, which is the coalition of LGBTQ community centers, which in many of the communities around the country, including a lot of the smaller places, that is the organization that is serving the community, and they'll be serving elders, they'll be serving young people, they'll be serving all kinds of people. And that is something that you could just look up online as well as another alternative. Here in the Bay Area, there are groups like Open House and Lavender Seniors and others that are directed specifically towards supporting our elders. And you can contact Horizons Foundation for more information about anything in the Bay Area, because we're delighted to provide that kind of information about Bay Area organizations and connecting people who want to support them to those organizations.
And Roger,
HorizonsFoundation.org.
and
Yes.
Roger, why don't you go ahead and give us the URL for the website for foundation?
www.horizonsfoundation.org is our website, and you can just send an email to info@horizonsfoundation.org, and it will be appropriately routed.
Thank you.
And we'll do the same with Dr. Cahill and Dr. Nass. Dr. Mayer had to drop off for another appointment, but we can also get a hold of him through the Fenway Institute. So, Dr. Cahill, how do we get a hold
Yeah,
of him?
so our website is www.fenwayhealth.org, FENWAY health.org. We have two organizations that do a lot of work locally on aging issues, the LGBT Aging Project and the LGBT Elders of Color. They manage congregate meal programs around the Commonwealth of Massachusetts and a lot of other services, all of which are becoming virtual at this point.
And Dr. Nass?
And GLAMA is online at www.glma.org, glama.org, and a couple of services that folks can help us with. We have an online provider directory, the largest online provider directory in the US, listing providers across all medical specialties, all health professions, including the behavioral health, psychology, counseling. So if you are a provider of any of those services, please go online to glama.org and set up a profile. It's free for you. It's free for anyone to access. So folks out there in communities where they don't have adequate resources can maybe have somebody to reach out to in a time of need. And also, if you are an individual who's in need of services, please check out that directory as well. It's free to search. We don't collect any information, so you can do that completely anonymously to find someone who might be able to help you in your community.
Well,
Just one last website note.
Sure, Roger.
For folks who would like to support our community, but aren't sure about the organization to support, our COVID-19 emergency fund is easily found. It's just horizonsfoundation.org/COVID-19. And it's all very simple, and all donations are 100% going to organizations that are helping our community respond and take care of itself.
Perfect. Well, that concludes our program. I want to thank all of you and extend our thanks to Dr. Mayer, Dr. Cahill. I know he had to drop off, but thank you. Thank you all for joining us here at the Commonwealth Club virtually, by the way, not here. And be safe and be well. And thank you for joining us for this special program. We have more coming up. John, people can see all the programs coming up at
CommonwealthClub.org/online. If you want to specifically see Michelle Meow, go to CommonwealthClub.org/MMS.
And I'll make a personal plea. Please, if you can, also support the work of the Commonwealth Club. It's truly so important during these times that we are isolating, but getting the information out. We'll see you next time.